Gurmaigad Yaskin Corlia. Tonish Boilum, Kish in the hospital of Flaylat and Yugas Gaherio, here in the Yapaha and ICU. Tessagon, you know, all the Sahanic, Honsalas Signé, go treating Jig their hospital or foot instead. Now will Yabi be the ICU or fuel, Charterella, now will Yabi away, Lefuel, Augusta and Foreign at a Gopperson Hospital for Vru Miltina. Eganam Kierna, Tessagon goal, an on-call for Ireland, goal Nismona Quickhead or Mila Quickhead, Danye Doctory, Altry at assess the Hologopi in our hospital, Acna will Conry Fuechagan, Tessagon Foster, goal couple of kid, Altra at assess the heart on the Cheetah Shaw, Acna will and Ringleagas Kirch, Cadu Navisas Defa and Am to Shalakula Trivi. So Kaihir Nismo Yenu can doubt Honishte Erin Evershaw. Tonish, in the past number of days, the situation in our hospitals has continued to deteriorate due to the number of COVID-19 patients requiring hospitalisations. And the daily operations update on the situation in our acute hospitals is one that makes for very grim reading. The latest report available from yesterday states that there are now 13 hospitals without any ICU capacity, 7 other hospitals that just has 1 ICU bed left, and the sizable majority of patients in ICU beds throughout the state are now there due to COVID-19. ICU capacity, we're told, is expected to be used up by the weekend, as reported in the media. I want to first of all express my solidarity with the staff in all of our hospitals and indeed the patients. Our staff are experiencing at the moment something that is unimaginable. It's a very worrying time. They're overworked, they're exhausted, they're anxious about the period ahead, and many of them are angry that they're left in this situation. So the least we can do here is thank them for their work and express our support for them at this extremely difficult time. Over the summer, Taoiseach, you will know that Sinn Féin warned that capacity needed to be ramped up. This didn't happen in sufficient ways. The IMO warned you upon publication of the winter plan that it was insufficient and that more needed to be done. And the failure to build in the necessary capacity has left us again relying on surge capacity and the option of using private hospitals, and these remain the only options to alleviate this situation under the government's disposal at the minute. My own local hospital, Taoiseach in Letterkenny, has just a handful of acute beds left throughout the hospital at this time and has no available ICU beds. I know from speaking to staff at the front line that they are very anxious about the coming weeks and that they're very worried. They know that we can't conjure up capacity in a couple of days, and there's a huge job of work to ensure that our medium and long-term capacity expanded. But there are a number of things that we can do to help to alleviate the situation in the short term. The deal with the private hospitals, for one, is one of them, a deal that provides a third capacity. Can I ask the Taoiseach, does he believe that that is sufficient amount of capacity? Does he believe that it should be increased, and has discussions begun to increase that capacity? There remains a pool through the Be Oncall for Ireland initiative of around 1,500 healthcare workers. Many of these are job ready, nurses, doctors, other staff willing to take up work in our hospitals but haven't been deployed. So can I ask the Taoiseach, why haven't they deployed, and when will all the nurses and doctors that are making themselves available be deployed in our public services? In addition, there are currently serious delays in processing atypical working visas, which is preventing the recruitment of healthcare staff. We're told that it's currently taking 10 to 12 weeks to process the applications for these visas. The Royal College of Surgeons had to cancel 200 RCSI exams for nurses due to the delays in processing the applications in January alone. Last March, the department was taking 48 hours to process these applications. Now it's taken up to 3 months. And the reality is, Taoiseach, if it wasn't for the department dragging their heels, we could have 200 nurses, additional nurses in Ireland by the end of the month. These are nurses, and I conclude on this here, that are willing to leave their own home country to come to Ireland to work in our public health system at a time when the virus is at its worst. We need to do a lot better. So can I ask you, why is the department dragging their heels on this issue?
Thanks very much, Deputy. First of all, the situation in our hospitals remains very precarious and unfortunately is continuing to deteriorate. And I think the very best way that we can support our staff working in our acute hospitals is to continue to abide by the restrictions to social distance, to do all the things that's being asked of us. Because what we need to do is to decrease the number of people getting COVID and going into hospital, and that's the best way that we can turn the corner on the current situation. As you'll know, the situation in Northern Ireland is similar, if not worse. So I don't think today is a day when Sinn Féin, which is in government in Northern Ireland, should be scoring political points on an issue like this. The job you've done in Northern Ireland is not one to be proud of, in my view. In relation to the hospitals, at the moment there are 1,838 people with COVID in our hospitals and 176 in ICU. What is somewhat encouraging is the number of admissions to hospital yesterday was 149, but the number of discharges was 128. So the net increase, at least in the last day, was much smaller than in previous days. There is a glimmer of hope. Cases have been falling now for a number of days. We may see the number of people being hospitalised, the total number of people hospitalised, starting to fall in about a week's time, and ICUs starting to fall in maybe 2 weeks' time. But it will be a very difficult and very precarious and very dangerous situation for the next 2 weeks at the very least in our hospitals. In total across the hospital system, I appreciate it varies from place to place, but in total across the hospital system there are 510 acute beds free today and 29 ICU adult beds free today. There are also paediatric beds. So it is possible, and it is not unusual for people to be transferred from one hospital to another where there is capacity, and there are 29 ICU beds available today and 510 acute beds across the system available today. In relation to solutions, which you touch on, what can we do to alleviate the situation, to make sure that our hospitals don't become overwhelmed over the next couple of weeks? Yes, there is the deal with the private hospitals. That allows us to use up to 60% of their capacity, not 30%. So those discussions are underway with the hospitals at the moment. The 30% is secured. A further 30% can be sought, and that has been sought, and we're going to try and access that. It's also possible to create surge ICU capacity within our hospitals. Now, we have increased ICU capacity since this time last year, but I think as people appreciate, an ICU bed is not a bed. It's an entire care system and requires trained staff and qualified staff. So we have the kit. We have 1,800 ventilators. We probably only have 100 or so people on ventilators at the moment. We have 1,800 ventilators. We have the kit, but having the staff trained up and ready to go is a different matter. And some are out sick, some are close contacts, and they can't come to work. And lots are really exhausted after a very difficult year, which I think you will appreciate. But we can provide extra ICU capacity, which is the surge capacity, by turning ordinary wards, theatres, recovery areas into additional ICU beds. In terms of the Oncall for Ireland issue, I'll ask Minister Donnelly about that, and we'll come back to you about it. My understanding, though, that when we ran that programme some months ago, it ran into real difficulties because a very large number of people who signed up were not qualified, and many were already working, for example, in nursing homes and were seeking to transfer to hospitals, and that's not something we want to happen because nursing homes are under pressure as well. But I'll certainly seek an update from Minister Donnelly on that and come back to you. On the working visas, I wasn't aware that that was the situation in relation to working visas in my department. There can be delays, but the turnaround times that you gave now versus then are new to me, and I will take that up with my Secretary General and see if there's something we can do.
Minister, the issue is very, very serious. My own hospital in Letterkenny had 7 ambulances parked outside it on Sunday night. Patients were being treated in the forecourt of Letterkenny Hospital in the ambulances because there was no capacity. There was 11 beds that were closed within the hospital because of staffing shortages. As you say, many are out sick, up to 180, either close contacts or COVID positive themselves. What concerns me is, for example, and we have the statistics here, that there are hundreds of nurses which are qualified and job ready, completed clearance on Call for Ireland who haven't been deployed. There are doctors, 268 in the pool currently of doctors. There is 1,491 total in the pool, over half of them job ready, and they haven't been deployed. 200 exams had to be cancelled for nurses that were willing to come to this country. Applications that were made as far back as November that still haven't been processed. People who are supposed to be taking up positions in community settings and different hospital settings throughout the state, but it is the system, it is the visa application system that is preventing them. Now, I finish on this here. We all absolutely recognise the work of our frontline workers, but we have a responsibility when people are willing to step forward and assist them and take some of that pressure off them to make sure all the red tape is taken away. So can you answer those questions?
Thank you. Tánaiste.
Thanks, Deputy. In relation to the On-Call for Ireland, as I mentioned earlier, that was something that we launched last March. I launched as Taoiseach with Minister Harris at the time. We had a huge level of interest in it, but it didn't turn out to be what we thought it would be, because we did find that a huge number of people weren't available for work. They weren't resident in the state. Some were already working within the health service, and we didn't want to redeploy them from areas where they're already working, and then others didn't have the appropriate qualifications. But I will seek an update on that from Minister Donnelly, because things may have changed since I last looked into that, and I'll do the same in relation to work visas. That matter has not yet been brought to my attention in person. HC hasn't said to me that that's an issue, nor has the Minister for Health. It may well have arisen in written questions, but nobody's raised that with me in person until now. But I will certainly look into that and see if there's something we can do. It is important, though, to point out that working visas do need to be processed properly. Ultimately, we've an obligation and a duty to the public to make sure that people are safe, and that those who receive work visas and work permits are who they say they are. And have the qualifications that they say they have. So it can't just be done overnight, but perhaps it can be done more quickly.